And now we're just going to give a quick overview of treatment options. So the first one obviously is to patch an eye. That if someone's having double vision, if you just occlude one eye, you're going to break their double vision and they'll be fine. And a lot of people, for a lot of people, this is a great solution, particularly in the beginning while they're still being hospitalized and worked up, where sometimes I see patients like this on the ward who are saying, oh, I'm happy that the doctors are trying to sort this out, but I keep walking into things in the room, and what do I do? And just in the meantime, patching an eye is a great option. If they wear glasses, then an even better option is to take one of the lenses of their glasses and to cover the lens so that they don't have a patch that's directly touching their eye. And this can be used for all cases. It particularly might also be a good choice sometimes for myasthenia gravis, where I will see other options are problematic for myasthenia gravis because the situation is continuously fluctuating. So prisms, we spoke about prisms earlier in the lecture, and prisms certainly can be used to help the patient alleviate the patient's double vision. And the idea of prisms is that we're saying that if we can't bring the eye to where it needs to be, we'll leave the eye to its deviated position and bring the image there by shifting it there with a prism. And there's prisms that can be actually made. These are stickers that can stick onto the back of the glasses, and so they can be a very good temporary solution if you think that the strabismus is just there for a little bit and it's going to go away within a couple of weeks. And here's an example of a sticker that's been put on the back of someone's glasses that's helping to alleviate their double vision. In this case, it's only been put on the top part of their lens. So another option that's sometimes used in strabismus is to treat with a Botox injection. This is a rare option, but in certain cases it can be done. And the idea would be not to target the muscle that's been palsied, but its antagonist. So that, for example, if someone had 6th nerve palsy, and because of 6th nerve palsy the eye is turned in, then you inject the medial rectus with Botox, and now you've weakened, hopefully, the medial rectus to the same degree that the lateral rectus is weakened, and the eye becomes straight again. Obviously, again, this is only a temporary solution that lasts for a couple of months. And this is something that we rarely use depending on the circumstances. So we've spoken about that. And this is an example of a video where we inject Botox into someone's eye. I'm going to save you from having to watch it because it doesn't have much teaching value for a medical student. The final option, of course, is to do surgery. And to do surgery, we operate on the eyes and to try to alter their positions of the muscles, of how they're inserting to alter their tension. So let's say we have a situation here where we have the two eyes, we're looking from above. Let's say that because we're looking from above, this is the left eye and this is the right eye, and we have a situation where the right eye is deviated outward. This is the cornea. And here we would have our medial rectus, and this is where it's attaching to the sclera. And here we have our lateral rectus, and it's attaching to the sclera at this point here. And here, this would be the back of the orbit. So what if we did a surgery where we loosen the tension in the lateral rectus and don't touch the medial rectus? Now the pull is going to increase relatively from the medial rectus, and the eye is going to turn in. And what we can do this by disconnecting the lateral rectus from where it is originally sitting and suture it further back. Because we've now created a lot of slack in the muscle, we're reducing the tension that the lateral rectus pulls with, and the eye turns inward, which is what we would want, and that's a favorable outcome. And that's generally the idea of strabismus surgery, is trying to alter the force of each muscle by either weakening it or strengthening it to increase its pull. And we actually do this based on tables, typically, where we decide how much the eye is turned out. With our prisms, we make a measurement, and that guides us about how many millimeters to adjust the various muscles by. Okay, we're going to end the lecture there. That's the extent of it. I hope that this was helpful, and good luck, and see you in the future.